Hello everyone, welcome to week 6 of the Psych Elective. This is our second to last week of information. It's gone by really fast, and I hope you guys have been enjoying the topics that we've been covering. Last week we had the topic of pregnancy and psychotropic use, and for your discussion board you were asked to take a stance either for the continuation of Paxil in our patient case scenario, or to discontinue use of Paxil and then provide evidence for why. And your responses were fantastic. For both sides, for both for and against, and hopefully what you realized when you were doing your research in support of the stance that I assigned to you was that it is not a clear-cut, for or against decision to be made. And so I think unanimously we all agree that untreated depression during pregnancy can be very detrimental, to not only mom but also to baby. So that probably isn't the best thing. We might want to offer some sort of solution. Some of the arguments for continuing the use of Paxil is that the patient has found something that has been very effective for her over the past 8 years. She's gone through some trials with other antidepressants that were ineffective, and she really doesn't want to go back to how she was feeling before she got put on Paxil. And so, I think what we see there and for the 4 is that not only it works for the patient, but the risk-benefit of keeping the patient on it versus taking her off, it might be more risky for the patient to have untreated depression or to go back to having those symptoms. There is inconsistent evidence on the effects of paroxetine on the fetus. And so while some studies show potential heart defects, there are other studies that don't show that. So those were other arguments for keeping her on Paxil. So in this case, it was more about the risk to the mom outweighed the benefits of the risk to the baby. For the against, it was also identified that there is a lot of inconsistency in the literature. This here obviously was weighing that the risk to the baby with heart defects was larger than the risk to the mom. However, several of you had suggested, instead of just discontinuing you and just leaving her untreated, you did offer some alternative treatment options. So several offered different types of behavioral therapies, so cognitive behavioral therapy, maybe she tries mindfulness training, yoga, so some more psychotherapeutic approaches. Several of you suggested that she switch to Sertraline, which is another SSRI, but it actually wasn't stated that she had previously tried it. So this could be effective for the patient, and it is considered safer for use in pregnancy out of the SSRIs. Downsides when discontinuing the medication at any stage really is that we can't just stop them. We typically would discontinue through a taper, and then we would start the new medication and we would start through a taper up. And so that takes time. And so we do run the risk of there being some issues with side effects, withdrawal symptoms coming back, so forth. But in the event that we discontinue her, we shouldn't just stop her on the Paxil. That might pose some risks as well. So, you know what? This was tough, and there isn't a right answer. I'll share a personal story with you. So I think I had mentioned in one of the other videos that when I was in graduate school, near the end of it, I had basically like a nervous breakdown. And my anxiety and my depression became so intense that I couldn't function anymore. And this wasn't something that emerged in graduate school. I hit the breaking point then. So I'd always kind of struggled with this, as well as some PTSD. So I was tried out some different medications, and what I found eventually worked for me was Paxil. Okay, so I was on Paxil, and that actually worked really well. Then in 2009, I got pregnant with my my first child, my daughter, and I went to my first prenatal visit, and my doctor had told me that I couldn't be on Paxil because of the increased risk to the fetus. So they took me off of the SSRI, but they said there wasn't anything that I could take, so that I would just be unmedicated. So I went through my pregnancy unmedicated for my depression and anxiety. Plus, this was my first pregnancy. I was moving back from Manhattan, New York to Michigan. There was just a lot of transitions in my life at that time. And I started to kind of feel how I was feeling in grad school again. Besides the hormones and everything changing, it was like exacerbated tenfold. And it was pretty awful. And I think I did not enjoy my pregnancy as much as I could have had maybe my depression and anxiety been treated. I was doing psychotherapy at the time, which was very helpful. But the medication for me kind of takes off the edge of the symptoms. And so it makes the symptoms lessen a little bit so that I can focus on the psychotherapy piece of it. Without that, it's really hard for me to keep my thoughts in control and kind of not let the physiological feelings that I'm getting take over. Okay. Once my daughter was born and I was done nursing, I went back on Paxil, and it didn't work. I didn't respond to it the same as I had before, and I had been on it for several years before then. So I kind of stayed on it. I didn't really say anything or do anything about it. And then I became pregnant with my second child, my son. And so I went to, got a new doctor, new OBGYN. And when I went to that visit, I said, okay, I know I've got to go off of Paxil and I can't take anything. And she said, wait a second, that's not true. She said, yeah, we might see if we can switch you off of Paxil. And I said, that's fine, because it's not even working for me anyways. And I was really struggling as a new mom and everything. And so she said, but Sertraline is an option. And so she talked me through kind of the risk benefits, the evidence or inconsistency in evidence. And she really outlined to me her concerns for my own mental health and well-being during my pregnancy. And wanted to make sure that I was taking care of myself. So I went on Sertraline while I was pregnant with my son, and I had a completely different experience. I felt much more in control. I enjoyed my pregnancy, and that could be due to the medication. It could be managing my symptoms better, but it could be that this was my second pregnancy. I knew what to expect. I knew that I wasn't going to be like ginormous for the rest of my life. I wasn't just moving across country, so I was more stable in my life as well. But for me, I didn't want to put my child at risk, even if there was a small chance. But at the same time, I knew that it was going to be more dangerous for me not to be treated. So, I took that chance and it helped. And then I was able to stay on it even after, and it's been very good for me. So I just want to share that personal story. Some of you may know people that have gone through something similar, or yourself. But I just wanted to share that with you because I kind of had this same sort of experience. This patient case was not written based on my life. So those were excellent responses. The second part of last week was the Psychiatric Panel. And it seemed like everybody really enjoyed it from your reflections, and that it even, while it increased the interest of psychiatric pharmacy as potentially a career path for some of you also decided maybe it wasn't quite the field for you, and that's fine, and that's great. That's the point of this course. That's the point of the panel, is to kind of introduce you to new ideas and new fields in pharmacy, and help you identify things that fit more in line with what your interests are. And maybe you're interested in it, but when you learn more about it, it's not quite what you thought, so you're not really interested. So that's great. Some of you have been contacting me about reaching out to some of the panelists to get more information. And so I have sent emails out to them asking if it is okay for me to share their contact info, which I think will be fine. They're not going to say no, but it is a professional courtesy for me to ask before I just give out their stuff. So I will be responding shortly once I hear back from them. This week, I kind of rearranged the last 2 weeks' topics a little bit. So this week, we are going to study mental health and treatment kind of across the lifespan. So the first part is going to be focused on child and adolescent psychiatry. And so there are a couple of papers and things for you to read there. The assignment is a case study, and the instructions for the assignment, the worksheet you fill out, and the submission are all kind of in the one. It says child and adolescent case study assignment and submission. So it's all listed within there what you're supposed to do. But what will happen is you'll go to an external website that has this patient case of a child, and it will ask you to make 3 decisions in treatment. So it'll give you the background, the history, what the child is there for, and then it will give you three options, I believe it's 3, of what we should start, the initial treatment. So you will choose one of those. You'll click the button. On your worksheet, though, you will answer some questions on which one did you choose, why did you choose that decision, and then you're going to reflect on whether or not your decision was consistent with what then happened. Okay, so then you'll get some information about the patient after you made that decision when they come for their return visit. Then you'll be asked to make a second decision based on their return symptoms and so forth. And so for each of those decision points, you're going to be answering those same questions, and you'll be submitting that worksheet. So you can select, you can kind of do this, this scenario or simulation a few times to try it out. Sorry, I gotta let my dog in. But hopefully you'll find it interesting, and don't forget to support your resources, support your arguments with resources, okay, or your decisions. Okay. Then the second part of our topics for this week is going to be geriatric psychiatry and dementias. So Dr. Bacon has put together the materials. She has an activity worksheet for you to do. So this is going to require you to go and look up more information on treating geriatric patients in psychiatry. But the way she's designed this worksheet is going to be not only useful for learning more, but it's actually going to be really useful for preparing you for boards. So she kind of kept that in mind when she was creating this worksheet. So this will also be a good reference for you. Then so you'll be submitting that worksheet, and then there's also some links and some documents for the MOCA. Okay, and so this is going to be a questionnaire that we assess cognitive ability and cognitive function. And so this is commonly used in primary care, not just in psychiatry. And so there's a video on how to administer this assessment. And then there's a PDF with instructions on how you administer and how you score the assessment. And then there's the actual test. And so this is, the MOCA stands for the Montreal Cognitive Assessment. So what you're going to do is you're going to find somebody to do the MOCA with. This could be a family member, a friend, one of your classmates, doesn't matter who, and you don't have to disclose who you do this with. But I want you to do the MOCA with them. And then on your worksheet that you're filling out, at the very, for the other assignment, or for the assignment Dr. Bacon had put together, you'll enter in what the total score was for the MOCA at the bottom of that worksheet. You'll see, it'll say, what was the total score for the MOCA? So those will be your activities for this week. So there are no, There are no discussion boards that you'll have to respond to. These will both be submissions, assignment submissions. Then next week, for the last week, we're going to be covering mental health disparities in diverse populations. So mental health for different race, ethnic groups, as well as LGBTQ community. So I'll talk more about that next week. But if you have any questions, feel free to email me. Have a good rest of the day.